Should ending private insurance as we know it be a Democratic Party goal? And do you think it's an urgent goal?
Oh, yeah. It is a goal and an urgent goal, but let me explain. I ran on Medicare for All in 2006 in my upstate New York 2-to-1 Republican district. And the reason I ran on that message was because I listened first. I traveled around the district, asked people what's on your mind, what's your worry. Overwhelmingly, they said, I'm worried about access to health care. I'm worried about being dropped because of a pre-existing condition or too much deductible or copay or monthly premiums. And so I said, well, how would you feel if you could buy into Medicare at a price you could afford? Would that work for you? That it'd be open to you no matter what, Medicare for all. And they said, oh, I would love that. And we explained, well, clearly what will happen is you'll create competition in the system because the for-profit insurance companies, their obligation is to their shareholders, not to their patients. Their goal is actually to make money every quarter, pay their CEOs millions of dollars, and they put a big enormous fat in the system, enormous cost in the system, because their priority is their returns and their profits. They deny you an extra day in the hospital or a certain medicine because they will make more money if they do, not because it will make you healthier. So describing this to the district and the people who live there was something that they fully understood and said, yeah, we'd love more competition. We'd love a not-for-profit public option. So that's what I ran on. When Senator Sanders was working on his bill, I asked if I could write the part about the transition. Because to me, the quickest way you get to single payer, the quickest way you really get to Medicare for all is you create a buy-in. And so we wrote 4% of income for the first 4 years. Anyone can buy in. That is a price anyone can afford. And if you're just a middle-class person who works hard, you think about your own budget, 4% of your income is less than you are paying today for whatever private insurance you have. And so what's going to happen is you're going to have enormous competition. And I don't think for-profit providers will be able to compete because they have to have that layer of fat, they have to have that shareholder value, they have to have that quarterly profit. And so through competition, you will get to single payer and you will get to healthcare and all the money that you spend on it going directly to the providers. You don't need the middleman. So I don't think they're going to compete. I don't think they survive this process because they are too concerned with their own profits.
So one more question about this. On the one hand, I think there's been this criticism of the left that there's a lot of Democrats out there that are trying to blur the difference between access to Medicare and truly single payer. And at the same time, I think that there's some concern on the part of people that are proposing more access and like public option type programs that some on the left aren't worrying enough about the transition period. And you've talked about this transition where there's an access period, but a new CNN poll found that among people who support a national insurance program, they do not support completely replacing the private insurance system. Do you think that even in a system where there's a period of time where people can buy in, do you think that we're talking enough about the political ramifications, even if it's the right thing to do, the political ramifications of telling people that their private insurance may go away?
I don't think you have to tell anybody anything. I think if you just give them a choice of having a not-for-profit public option whose goal is to make sure you are healthy and have the medicine you need and the care that you need, instead of an insurance company that's goal is to make sure that their shareholders get a quarterly profit, it's not even going to be a close decision. People are going to choose to give the money directly to the doctors, to the hospitals, to the healthcare centers, not to the insurance companies. And the truth is, you don't need a middleman. You don't need a middleman. If you believe that healthcare is a right and not a privilege, which I think the majority of Americans, if not all Americans, believe, if you believe that healthcare should be a right and not a privilege, then you should make sure you have universal access that's affordable. The quickest way to do that is Medicare for all, having the not-for-profit public option. It gets you to single payer fastest. If there's a private sector market that's still working, God bless them. That's their issue. Our issue is universal coverage that is quality and affordable care for everyone. I don't think there's going to be a role for insurers because if you want to go get plastic surgery, you can pay for that. That's
good to know.
That's the extra stuff that's there for you if you want to pay for it. But in terms of your health and well-being,
I just got to get for me. I'm just going to get this just a little.
Yeah, in terms of health and well-being, that should be covered in a Medicare for all structure.
So your Medicare, so when I get this tightened up.
You can pay for that yourself.
Shame, I liked Senator Gillibrand.